So countries like the U.S., Israel, and the U.K. are already giving out COVID-19 booster shots. And while BC has just announced it will be rolling out the same for most of the country, third doses are still only recommended for certain people, like those who are immunocompromised. For more on this, I'm joined by infectious diseases specialist, Dr. Isaac Bogoch. Doctor, nice to see you this morning.
Hey, good morning.
Okay, so is there a difference between a booster shot and a third dose?
You know, we talk about them like they're the same thing, but they're actually not. When we say a third dose, we're really implying that this is actually a 3-dose vaccine series, and many of us have had 2 doses of a 3-dose vaccine series. When we say the word booster, we're implying that we finished the vaccine series. It didn't work as much as we wanted it to work, and we maybe think there was waning, and we have to give a booster vaccine. There actually is a difference. I think you'll start to hear the term 3 doses more and more because, quite frankly, for very likely for most people, this is going to be a 3-dose vaccine series.
And that just means like a full dose again?
Yeah, it basically is. Actually, it's complicated.
Okay.
It depends. Like anything else in medicine, it depends. So for the Pfizer vaccine, in adults at least, that third dose is exactly the same. Moderna has actually made a third dose that's got a smaller amount of the mRNA in it. And there's been several studies looking at a third dose with that smaller dose of Moderna, and also studies looking at a third dose with the regular dose of Moderna. It's unclear as to what will roll out in the United States and what will roll out in Canada with Moderna on that front.
And speaking of rolling out, why are Canadian health officials not recommending everybody get one of these right now when they're eligible?
Well, I think it's fair to say, yeah, I mean, I think it's fair to say that in general, in Canada, we're a bit slow here, and we should have an expanded third dose program in the country. And I think we're going to hear more about that sometime either later this week or early next week. And we're past time. Like, we should really have been farther along than we are right now. Having said that, I think it's also fair to say that when you ask the question in October of 2021, do we all need a third dose? The answer is absolutely not. Many people do need a third dose in October and November of 2021, but we all don't need a third dose in October of 2021. We'll hear some clarity over that, but I think we should really start moving third doses into community dwelling, senior populations. We're already in most of the country giving third doses to those in long-term care facilities and immunocompromised populations. There's probably also room to expand this into many healthcare providers and also into people with other underlying medical conditions that would put them at greater risk for severe infection. So there's certainly room to expand who should get a third dose of a vaccine in Canada right now.
And I'm just thinking about timing. So for somebody that received their second dose sort of at the early part of this year, let's say, I don't know, March, April, or May, how long are you protected?
Yeah, I mean, it's interesting because when you ask how long are you protected, it's really how long are you protected against severe infection, hospitalization, and death. And in fact, the effectiveness of these really stand the test of time. And in fact, there's probably, still about 90-ish% effectiveness against those severe infections. But what you're starting to see is with just 2 doses of the vaccine, people are more susceptible to reinfection. And there's shreds of evidence, but real evidence demonstrating that there is some waning after 2 doses, after, a period of time, and that might be anywhere between 6 and 9 months. I think what we'll start to see is, in general, most provinces will probably start to give those third doses at the 6 to 9 month mark. I think they'll focus more on adults and vulnerable populations first, which they absolutely should. And then I think the big question is, what do you do with the younger groups? Like, what do you do with the 12 to, I'm making up a number, 20, 25-year-olds, people in that age range.
Right.
And it's not quite clear if those individuals would benefit from a third dose when they meet that 6 to 9 month mark. And again, let's let the data drive the policy. I don't think we have the data yet to drive that policy.
Dr. Bogoch, always appreciate your time. Thank you.
Have a great day.
You as well.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.